What's up, y'all? BJ Drum Major 919 News back with another update. I told you I keep you updated on this coronavirus for as long as you have to deal with it, so that's what I'm doing, man. Go ahead and stick to what I told y'all I'm gonna do. Give y'all the latest information and the best updates on YouTube. Period, man. This is what I got for y'all today. It's kind of crazy because I'm seeing stuff and just tying dots together and trying to figure out what's going on. And as I do that, I'm bringing it to you, but I'm still working and everything right now, trying to go ahead and keep the income coming in despite this crisis that we got. So I'm trying to go ahead and do this work. Got 2 jobs, still in school, so it's just a lot that I got going on. I can't put out videos as much as I want to, but as I can, I will. Trust me, I got you. What we're gonna talk about is COVID-19 again. Once again, we're talking about coronavirus 19 because it's just something that's affecting the nation, affecting the whole world. And it doesn't seem like it's stopping anytime soon. And some of the highest places that we have across the country right now, places like New York, New Jersey, and California. We're gonna talk about those in just a second. But right now, we're just going to touch on what is affecting us the most and what is affecting people the most. And that's the healthcare workers, because the healthcare workers are running out of PPE equipment and not able to get masks, gloves, gowns, and things like that. They're having to go ahead and quit their jobs. Some nurses are quitting their jobs because they don't have the necessary PPE equipment. And I understand that you got to want to protect yourself, protect your family, protect those around you. The nurses and the doctors and some people of high medical quality are quitting and just laying down their gowns basically and taking off their masks because they don't have the necessary PPE equipment to try to protect themselves. It looked like they just hit that van right there. Anyway, yeah, it's just crazy because this virus is taking off and it doesn't seem like it's slowing down at all. That's one of the Navy hospital boats that they got coming out trying to protect and try to help take some of the pressure off the hospitals that we have on the East Coast and the West Coast. We have one on the West Coast and one on the East Coast. So that's a boat that's usually used for wartime events. And President Trump has definitely called this a war. He calls himself a wartime president fighting an invisible enemy. I don't know why he keep calling himself that. He really seems like he wants to be a wartime president, but this is something different. This is a national crisis. This is not necessarily a war, in my opinion. We've got so many cases of confirmed coronavirus cases across the nation right now. We got about 4,000 deaths in the U.S. from coronavirus just itself, which is a high, staggering number because the coronavirus toll has exceeded the amount of Americans that we lost in 9/11. So that's a very high and eye-opening number for me because we lost thousands of Americans in 9/11 just in one day. And the fact that we already lost all these Americans from coronavirus, from something that could have been prevented, is just really eye-opening and shocking to me. I just can't believe that at all. And they say that the nurses really need the PPE equipment and everything like that to try to prevent that virus from spreading, which I understand because that virus can stay alive on surfaces for 3 to 5 days, which is a very long time for something to be on a surface. Just got to think of it like this. Imagine if you're just going out, you have the virus. I'm not wishing that on you or anything like that or anybody you know. But imagine if you had that virus and you go out, you touch a door handle or something like that. Or maybe you go and sit down somewhere. You sit down on a park bench like her, then you have that virus on you, and then another 10 people, 15, 20 people come and sit on that bench that day as well. So that virus has been transmitted to all those people that sat down on that bench, and they're going to sit down and go somewhere else and go do other things. So that virus is going to then go to another 100 people, then from there it's going to go to 300 people, then from there it's going to go to 1,000 people. So you just have to keep that in mind of why it's so critical to protect yourself and make sure you have the necessary PPE, because that's how we beat this virus, to try to prevent it from spreading and to stop it from getting other hosts. It only thrives off hosts. If we stop the hosts and things like that, we'll be able to stop this virus. And that's Andrew Cuomo and his brother Chris Cuomo. Chris Cuomo is an anchor on CNN news anchor. Andrew Cuomo is the governor of New York. Of course, you've seen him all over TV with Dr. Fauci and everything like that lately. And his brother just got diagnosed with coronavirus. So that tells me that nobody's really safe during this crisis. We've got celebrities getting coronavirus, all these people getting coronavirus, whether you're in Hollywood or whether you're in the woods. Like everybody, even people in jail are getting coronavirus. We got inmates in Cook County right now. In Chicago, inmates are getting coronavirus. Over 100 inmates in one jail with coronavirus. And that's a very, very high number, man. That's basically like a petri dish for this virus, because nowhere for that virus to really go but inside those walls, unless the people like the bailiffs and everything like that, correctional officers, if they leave, they have the possibility of spreading that virus too. And they also say that the correctional officers, some of them in there, have been tested positive for coronavirus already. So that tells you that it's spreading amongst the inmates and also spreading to the officers and the staff inside of those penitentiary facilities. All right, so you just gotta protect yourself and try to prevent that from spreading. They said they're letting people out of jail because of this virus. Like, it's been a big jailbreak. Hundreds of inmates have been released across the country just try to prevent this pandemic and to try to slow it down and stop it inside of those walls and try to slow it from spreading from person to person so much. So people have been released from prison or jail just for this virus, which is a great thing to try to release people from prison and everything. But you know, you got to kind of weigh the pros and cons of that, because who you're releasing from prison, I hope you're not releasing a murderer or anything like that, or better yet, I hope you're not releasing a rapist from prison. Like, you can release the murderers, but keep the rapists in there. I know that may sound crazy to some people. We don't need rapists on the street at all, period. That's just disgusting, and they should be locked up for as long as it takes. But murders and everything like that, we'll see. That has to be discussed. That's another video right there. But doctors warn us that the system is about to collapse. So what do they mean by that? Does it mean that everybody's going to go on strike and there's not going to be any doctors and nurses left to combat this? Are we going to run out of medical equipment and we're not going to be able to fight this because we don't have medical equipment like ventilators, masks, etc., blah, 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 and try to fight this virus? I don't know. We're just going to have to watch and see what happens. But I know right now we got several doctors and nurses quitting across the country. They're saying that they're having to reuse that same PPE. There's a nationwide shortage of protective personnel and equipment, so we're being required to reuse the same gown and mask the entire shift, which is just disgusting, because you just have the possibility of spreading that virus to so many people when you're reusing that same stuff over and over again. And look at this right here also, what I found. It says that they're making threats basically to the personnel. On top of it all, hospitals across the country are warning nurses that they'll be terminated if they speak to the press about the lack of protective gear. That's just crazy. So if you're speaking out about workplace endangerment, you will be terminated and fired for your job just for trying to speak out about the vulnerability inside of the healthcare system, which how you speaking up is usually how you get the things that you need. Like a closed mouth don't get fed. We all heard things like that before. So it's just crazy how they're being shut down and being threatened to lose and terminate their job if they speak out for what's right. And that's just, wow, that says a lot about what's really going on. If you speak out about what's right, you get fired from your job. That doesn't really make any sense, but I'm going to go ahead and keep it moving and look at some of the highest tolls across the nation for coronavirus. We have a couple other things to talk about today too, but I'm trying to keep this video short because I still got schoolwork to do. I got to go to work in a few. I got 2 jobs to do today. I got to go ahead and deliver some stuff, and I got to go ahead and go to my other job as well. So things are not really slowing down, but I'm going to get these videos out as I can. New York with 80,000 cases, New Jersey with 20,000 cases, California with 9,000 cases, Michigan with 7,600 cases, Florida with 7,000 cases, Massachusetts with 6,600 cases, and Illinois with 6,000 cases, which is a very, very high alarming number for all of these cities and states right here, for something that could have been prevented easily just by proper hygiene and things like that, trying to protect yourself and just being cleaner. I've seen people clean up like they haven't before. Like, people really should have been wearing hand sanitizer and using stuff like that on a regular basis before this happened, because we should have known all this ever since that Spanish flu, influenza happened in what, like 1912? We should have known all this and grew up from all that and had a better insight of what to do when a virus affects us, but we didn't really. So the virus right now, death toll is at least what, 4,000. Dang, that's crazy. That's a lot. As of Wednesday morning, the novel coronavirus has infected more than 874,000 people across 180 counties and territories, resulting in 43,000 deaths. Dang, so that's a worldwide total right there. 43,000 is the worldwide total. In the U.S., all 50 states plus the District of Columbia have reported confirmed cases of COVID-19, tallying over 189,000 illnesses and at least 4,080 deaths. So that number is just going to keep going up day by day. We're going to have to watch it and see how long this virus lasts. But in particular, one I talk about today is Illinois, man, because Illinois, you always popping up on the map as far as death, violence, and things like that. Anytime there's a national pandemic or anything like that, it seems like Illinois is always in the front lines on it, no matter what, never fails. It says, as of March 31st, Illinois reported at least 5,000 cases of COVID-19 and 73 deaths, which is not true, because on the same page where it says 73, it says 99 deaths. The death probably went up since 99 so far. 30,000 people have been tested for COVID-19 at IDPH commercial hospital laboratories within the state. So that's a good amount of people that's been tested. It's good to go ahead and testing those people. Look at the amounts in Cook County. Cook County is always Cook County that has the highest amount of deaths, no matter what you're looking at. If you're looking at stuff like Kanika Jenkins and stuff like that, if you're looking at murder rates, always Chicago. It's always Cook County that's in the front, on the front lines, the highest numbers of death across the country. Look at Cook County compared to all other counties in Chicago. We got about 4,000 cases just in Cook County, but all these other counties, it's like 300, 200, 150. St. Clair 36, Kanaki 33, Champaign 24, Kendall 18, McLean 17, Madison 13, Winnebago 13, Christian 12, San Amago 12, was Sangamon, whatever that is, 12, Del Cobb 8. A lot of these I've never heard of before, but I've heard of Cook County before. And so if you've been following that Kanika Jenkins thing that happened a few years ago, Kanika was a girl that was found in the freezer. I'm not going to call her a girl. She was a young lady that was found in the freezer, murdered in a Crown Plaza hotel, and they're saying that it was no foul play, that she was inebriated. She went into the freezer herself trying to get out and trying to find her way out. And she just went into the freezer and happened to lock herself in there. But if you look at the pictures and everything like that, you can see that Kanika Jenkins had like bruises over her hair, was messed up and everything like that. She looked like her lip was swollen. Like so much stuff was off about that picture, and it didn't really look like her to begin with. I don't think that was Kanika Jenkins, but go ahead and watch my other videos about that topic. But why does Cook County keep popping up in the limelight about deaths, viruses, and stuff like that? I just don't know, because Cook County, man, you just can't seem to stay out of the mess, can you? And we have about 99 deaths right now in Cook County itself from coronavirus. Let's see. All right. The new confirmed fatalities come as health officials on Tuesday announced an additional 937 COVID-19 cases in Illinois, bringing the state's total to 6,000 cases. So far, 99 people have died from coronavirus. Hope you saw that before it went away. I'm not sure why it disappeared. We're going to go ahead to the next screen. And Trump keeps saying it's going to be 2 weeks. Every week he says 2 weeks, 2 weeks. We've been hearing that for a while now, because every day feels like a whole week. Every week feels like a month. And every month feels like a year. So how long are we going to be going through this, huh? They say they want us to be safe, blah, blah, blah. But I just don't know if he really wants that. Like, what do you really want, President Trump? Because it seems like you're more concerned about the economy than anything else. Who knows? We're going to have to keep watching it and see what's up day by day. Let's read a little bit of stuff on Wikipedia. It says on March 31st, 937 cases were confirmed, along with 26 deaths that brought the total deceased to 99. So March 31st was yesterday. Today is the 1st, and this is not an April Fool's joke. Ain't nobody joking around today, because this is what we got going on. It's going to be the first time that I ain't played an April Fool's prank in like a while. But anyway, we're going to have to keep it serious just because of what we got going on. So on March 31st, in addition to 937 confirmed cases, were announced along with 26 deaths that brought the total of deceased to 99. And you can see the ages right here. Two males in their 50s, 1 male in their 60s, 2 females in their 60s, 5 males in their 70s, 2 females in their 70s, 3 males in their 80s, 1 female in their 80s, and 1 male in his 90s. So it doesn't seem like it really has a favoritism of age like we first thought, because I just saw a report the other day that said they lost an infant the other day due to coronavirus. So this doesn't have like an age bias like we thought before. It's affecting all ages, because I saw an 18-year-old died also. We have people in their 20s dying for coronavirus. We have all types of people that's dying for coronavirus, unfortunately. So we just have to watch this virus and try to wait on that cure that they say supposedly happen to get a vaccine coming soon. The people definitely need that, and the vaccine is going to be the key to stopping this virus, but it's going to be hard to produce that vaccine in mass, because we already got a shortage of that vaccine, and it's not a vaccine that we've been producing a lot, because it's a vaccine that was used for malaria, and we haven't really seen a malaria outbreak since Vietnam War. So we haven't really been producing that drug hydrochloroquine as much as we could have. But maybe this would be a learning lesson for us to try to stockpile more stuff, have like a worldwide type of emergency supply for stuff like ventilators, because I know the ventilators are running low, and they're saying that the health system is about to collapse. But what do you mean by that? Are they going to collapse by not having enough ventilators, not having enough healthcare workers, not having enough hospital beds, or what? I know this is turning into like a wartime crisis with those boats and everything pulling up off the coast of our cities like New York and California. We got big boats coming up across our coast, and they're trying to assist people and trying to assist the healthcare workers so they can have a little more assistance as far as trying to take care of people. That's the health boat right there, the big Navy boat. That's definitely only used in wartime and big fatality crises. So how much of this is we going to see? How long are we going to see this? How long are we going to go through this is the question. I don't know, but I'm going to keep y'all updated day by day, and I'm going to keep y'all updated on the news as I can. This is DJ Drum Major 919 News. I'm feeling good right now. Luckily, I don't have no coronavirus type of infection or anything like that. Taking care of myself, and I hope you do too, man. Let's get through this together. DJ Drum Major 919 News. I'm out.